All right, so what I want to do today is talk to you guys about your immune system when it relates to COVID-19. Over the last 3 or 4 months, there's been no national discussion about what we can do with our nutrition, with our hydration, with our sleep, things that better prepare our body in case we're ever exposed to any type of infection, whether that be COVID-19 or the common cold. All right, so what I'm doing in this video is to provide evidence that there is correlation between if you are deficient in certain vitamins and minerals, if you're not getting certain things in your diet, and the COVID-19 mortality rate. I do want to disclose this video. I am not a doctor, and nor do I pretend to be one, but what I am is a health and fitness professional who's been in this industry for over 10 years. I believe in a more holistic approach when it comes to healing your body. So using food, nutrition, hydration, and sleep to do these things, which can do a lot more than what people actually think. Everything doesn't need a drug, okay? So let's first start off with vitamin D, all right? And all this stuff that I'm going to talk about today, I'm going to provide you guys with evidence. I'm going to put links to the research down in the description, so you can double check my work. This is all just advice too as well, and things that I think that we all should be doing is focusing on our nutrition, focusing on our sleep, focusing on the nutrition that we're getting from our food. Because if you are concerned about an infection from this, we have over 4 million cases in the United States. You're probably going to be exposed to this at some point. I'm sorry to tell you. If not this, some other type of common cold. So these are just things that you should be generally be doing if you are concerned about your health. Okay. So first thing I want to talk to you guys about is some research that is related to when it comes to vitamin D and the infection. Okay, so deficiencies in vitamin D is associated with increased autoimmunity and susceptibility to infection. Okay, so basically that means if you are deficient in vitamin D, your body is going to be more likely to get infected, and that could be COVID-19, or that could be the common cold. All right, and there's plenty of research to show correlations that when we have deficiencies in vitamin D, our bodies tend to get sick more often and more frequently. So next thing, there was a study that was done that compiled data over the last 10 years from individuals who are 40 to 65 years old from these countries. Okay, it was actually 10 countries in total, but I'm just going to give you kind of some of the bigger ones here. It's from the UK, Ireland, France, Germany, Norway, and Estonia. And what they found was deficiencies in vitamin D strongly correlated with COVID-19 death. And they could explain these deaths. 58% of these deaths explained for deficiency. So what that means is that in this study where they compiled all this data, and Johns Hopkins was involved in this too as well, is that about 58% of the cases in this correlation, people who were deficient in vitamin D had also passed away from COVID-19. So one would think like, okay, if I am concerned about this, if I'm concerned about complications, if I'm concerned about death from this, maybe I should make sure I'm getting plenty of vitamin D. And I'll talk about how you can get that either through food or through the free way, which is through sunlight. We'll talk about that in a second. The highest people who are most likely to be deficient in vitamin D are going to be the elderly. And I want you to keep in mind when I'm listening to these people, what does this sound like when it comes to when you always hear about COVID-19 death? If you actually really look deep into the data about who's this truly is affecting the most, okay? The elderly, obese people, people in nursing homes, and hospitalized patients. So this are going to be, on average, the people who are most likely deficient in vitamin D, okay? And in the United States, to 50 to 60% of people who are in nursing homes or hospitalized in this study that they found were deficient in vitamin D. So think about this. So elderly, obese, nursing home, hospitalization, those are people who are most affected from COVID-19 thus far when you look at the overall percentages of death. They're also deficient in vitamin D. I'm not saying this is a direct component of it, but there is a strong correlation that we're starting to see with this data. And again, I'll provide links in the description too as well for you guys to check this stuff out. All right, here's some even more data. By analyzing publicly available patient data from around the globe, Beckman and his team discovered a strong correlation between vitamin D levels and cytokine storms, a hyperinflammatory condition caused by an overactive immune system, as well as a correlation between vitamin D deficiency and mortality. Cytokine storm can severely damage the lungs and lead to an acute respiratory distress syndrome and death in patients. This is what seems to kill a majority of COVID-19 patients, not the destruction of the lungs by the virus itself. It is a complication from the misdirected firing from the immune system. This is exactly where Beckman believes vitamin D plays a major role. Not only does the vitamin D enhance our innate immune system, it also prevents our immune system from becoming dangerously overactive. This means that having a healthy levels of vitamin D can protect patients against severe complications, including death from COVID-19. Okay, so there's plenty of research out there showing the correlations of this stuff, but how can you today start to implement some changes to make sure that you have optimal vitamin D levels? Number one, probably should go get a blood test to see where your vitamin D levels are at. You can either do this through any Quest lab if you're in the United States. They have several hundred throughout the country, okay? Number two, start getting more sunlight, 10 to 15 minutes per day, walks with plenty of your skin exposed. Number three, salmon, dairy products, fortified cereals, mushrooms are going to be plentiful in vitamin D. So institute those things into your daily regimen in your diet to make sure that you're getting an adequate amount of vitamin D. Okay, zinc is another one that's extremely important that hasn't been talked about too as well. So let me explain to you why it's important to your immune system, why it's important to combat pneumonia and respiratory tract infections too as well. All right, so it plays a huge role in our immune system development. So basically making sure we have a functioning immune system that's not overactive, that can combat infections. Deficiency leads to increased risk of pneumonia. What is pneumonia? Pneumonia is where fluid fills the lungs. That's a lot of complications that happen from COVID-19 patients. It also reduces the risk of the common cold, and it protects against respiratory tract infections. So it gives you a better chance to fight against those things. Respiratory tract infections is what COVID-19 basically does to a lot of people through those complications. So you're probably thinking, okay, like how can I get this through my diet if you don't feel comfortable supplementing, which always talk to your doctor before supplementing with anything anyway. So let's do it with diet first. We could do it through red meat, poultry, if you are somebody who eats meats. If you are not, you're vegan or vegetarian, you can do it through beans or nuts. For the red meat or poultry, I would suggest leaner versions of that so you're not getting too much saturated fat, because the typical American diet, we get too much saturated fat and not enough fiber. Fiber is very important to your overall health. I'll talk about that, particularly soluble fiber, next when I talk about your microbiome. All right, moving along, lifestyle. So this is probably going to be the overarching most important thing besides those two vitamins that I just mentioned before, because this ultimately leads to what's going to put us in the greatest health, okay? And what I mean by lifestyle, I'm going to talk about your microbiome, which is basically a compilation of your nutrition, your gut, the organisms that live in your gut, the both good and bacteria, their relationship, and how they protect against infection. For those of you who don't know, about 80% of your immune system is in your gut, okay? So 80% of this battle is going to happen to what you put in your mouth every single day. That's why the vitamin D is important getting it through your food or sunlight. That's why the zinc getting it through your food or sunlight is extremely important. What we put in our body matters, especially right now. So if you're concerned about infection, please, dear God, start to eat correctly. Eat correctly. Do not complain about concerned about infection and then go home and smashing cheeseburgers, fries, and drinking alcohol right now. I know a lot of people are underneath a lot of stress for one number of different reasons, but it's very counterintuitive to be like, oh, I'm concerned that I don't eat right. Eat correct. One of the most important things when it comes to your microbiome, soluble fiber. Soluble fiber, so there's two types of fiber. There's insoluble and soluble fiber. Soluble fiber is basically going to feed the good bacteria in your gut, what's called probiotics. Probiotics, I'm sure you guys have all seen them by now. You get it through like yogurt, you get it through sauerkraut or other fermented foods. These are going to be the good bacteria that help to have an overall healthy microbiome. This is kind of like their food, okay? You can get soluble fiber through vegetables, you can get it through oatmeal, you can also get it through some fruits too as well. So include those things in your diet. Make sure you're getting a good amount of soluble fiber. At the bare minimum per day, you should shoot for about 25 grams of fiber in total and about anywhere from 12 to 15 grams of soluble fiber, okay? If you have a hard time getting fiber through your diet because you don't like, oatmeal, which is fine. I know a lot of people are against the grains now, and you don't eat enough fruits and vegetables per day, even though you should, especially now because they have antioxidants, those two as well. You can definitely get this through supplementation, which is really easy, just a soluble fiber supplementation, all right? Sleep and hydration. So these are also very, very important too as well. Sleep, for one, this is when your body repairs itself. Not getting enough adequate amount of sleep is going to overall cause a enormous amount of inflammation in your body. So inflammation can lead to all types of diseases, disorders, high blood pressure, everything along those lines too as well. So just think about getting a bare minimum for adults, 7 hours of sleep. I know that's kind of hard sometimes for people, but you got to make the sleep happen. It's extremely important for your lifestyle and for your health. Hydration too as well, okay? So you can see people doing detoxes and all that kind of stuff. Nonsense, cut all that BS out. You do not need detoxes. That is what your liver is for. That is what your kidneys are for. Drink water. Your body is very efficient at eliminating toxins, and this is what hydration will do, okay? So this is important. Consume enough water, depending upon your weight, your daily activities. You can go to anywhere online, go to Google, type in water calculators to see how much water you actually need. I'm not going to tell you unless I'm personally building programs for you on how much water you need per day. And last but not least, just move. Exercise per day. So go on hikes, go on long extended walks, do at-home workouts right now. If you have access to a gym still, go to the gym, work out, wear all the masks, social distance, do all that kind of stuff. But you have to move because this is actually extremely important for your body to be able to make sure it's primed to be able to fight infections by make sure it's healthy, overall healthy, okay? So just move, just exercise. You can train with me, you can not train with me, whatever it may be, but just move, just exercise. Okay, so last disclaimer. I'm not saying this is a treatment plan or this is how you cure COVID-19. I'm just saying the best defense is a strong offense. And if you are concerned about infection, dear God, please start to eat right. Please start to sleep right. Start to hydrate and start to move. Do not complain about it if you're not doing these things, okay? This is really important. If you are really concerned about your health, take initiative, take some responsibility right now. That's what we all need to be doing, okay? The last 3 months, there should have been a conversation because a lot of people are unhealthy, could have got healthy during that time period so that when they do go back out in the world at some point and a vaccine isn't working or whatever our treatment plan is going to be, and they are exposed to it, their body has the best chance to fight it. That's all I want you guys to think about, just giving your body the best chance. And again, I am not a doctor, nor do I pretend to be one, but this is my career as a health and fitness professional, and I do this with my clients, this holistic approach that's customized for them, and I can do this for you too as well if you do not know how to do this for yourself, to give you and your body the best health outcomes when it comes to your lifestyle, your training, and all that stuff above, okay? Hope this video finds you guys well. Again, like, subscribe to the channel, hit the notification bell. If you're interested in my coaching services, go to t3body.com.